Respected chairpersons and judges, distinguished audience, I'll be speaking on the prevalence of blindness and visual impairment among people 50 years and older in Nepal. It's a RAP survey. This was to ascertain the causes of blindness and SVI in Nepal in all the provinces and look at age, gender, and province-based prevalence so that we can decide and implement policies to reduce the prevalence of blindness. It's the first time that since Nepal from monarchy became a democracy and the 7 provinces were formed, we are trying to find out from each province what it is the level of blindness. So this was the sampling and data collection done. It went on for 3 years because there was COVID in between. And this is the response rate from each province. And as you can see, there is almost a 98% response rate. If we look at the age and sex province estimated, then the prevalence of blindness in Nepal is just 1.1%, of severe visual impairment 1.7%, and mild VI 10.3%. And if we will look at by province-wise, then to our surprise, the provinces that are there in the plains, the Madhes province and the Lumbini province, they have almost double the prevalence of blindness than what it is there in the mountainous region. This was a surprise to us also because the Tarai region is where all the major eye care centers are located, and we thought higher up in the Himalayas there would be more UV radiation and therefore more cataract blindness. So this is the prevalence of blindness and visual impairment in Nepal, and as you can see, it's more in the Tarai region. We also looked at this prevalence and compared it with previous studies in Nepal. So in Nepal, about 25 years ago, the prevalence was 5.3%, and now today it is just down to 1%. So all this effort that has been made in last 25 years has really reduced the prevalence by almost 4 times. If we look at it, and these are wonderful studies from the RP Center with the RAB India studies, here also we find that the prevalence in Nepal is lesser than the prevalence in India, and especially if we look at the surrounding states, Uttar Pradesh, Bihar, Uttarakhand, Jharkhand, and West Bengal. Again, when we look at the causes of blindness and visual impairment, for blindness, the commonest cause is cataract. For severe visual impairment, it is cataract and posterior segment things. But in moderate visual impairment, along with cataract surgery complications is also a cause of blindness. And of course, for mild visual impairment, it is refractive errors. So if we see causes of blindness, mostly cataract. For causes of severe visual impairment, again cataract. But when we look at causes of mild visual impairment, it is refractive errors. So this is similar to what we have seen from other Southeast Asian countries. So I would like to conclude by saying that the prevalence of blindness in Nepal has greatly reduced over the past 3 decades. So all the work done by the NGOs and all the ophthalmologists and the healthcare workers has borne fruit. There is a very small gender difference, which is great because people think that in Southeast Asia, there is a huge difference between male and female blindness. That was not the case in Nepal. Cataract is still the commonest cause of blindness and SVI, perhaps due to the high UV exposure in Himalayas, and refractive errors is the commonest cause of mild and moderate VI. Retinal causes are on a rise, and the Tarai region, which has the most eye care centers, which has the largest population, has almost double the prevalence of blindness, so more work needs to be done there. So this is the message that we had, and I would like to acknowledge all our partners who helped us in this study. It's a beautiful country. It's a country where a lot of work has been done by the Nepalese and the Indians and the Indian Army. And it's heartening to see that the prevalence of blindness has gone down so much. Thank you.
Thanks a lot. How this study was conducted, the sample size and all? I think I missed those details.
So we have the RAB software. So the RAB software looks at
No,
the
I
sampling
mean,
frame.
was it a epidemiological survey
So it
or,
is
or
going,
the hospital-based?
No, sir, it's going to the population. So 50 plus people, they are made clusters of 1,000. Dr. Suraj here is an expert in doing it. So the RAB methodology, which is followed by the RAB India or RAB.
How much was the total sample size?
So here you can see the total people examined were 32,565 who are more than 50 years. So in the, yeah, sir.
No, sir. Thank you. Thank you very much.
So what explains the last point in your conclusion? It's a very nice study.
Thank
So
you, sir.
the last point regarding the prevalence, which is more in the Tarai areas.
So one of the reasons is perhaps the Tarai, with this is not done with the GDP comparison. So perhaps the Tarai is a poorer region.
Okay.
So we think that in the Tarai region, perhaps because it's easier in the plains, and the Tarai region has centers, but then half the population that the Nepal centers serve are from the Indian states of Uttarakhand, UP, Bihar, Jharkhand, and West Bengal, Assam. So with just more work needs to be done. We thought we've done a lot, but no.
Okay. Thank you.
Thank
Thanks
you,
a
sir.
lot. Thank you very much.